Public health advocates are urging Nigeria's government to drastically increase funding for tobacco control measures, warning that current allocations fall woefully short of addressing the crisis. At a joint press briefing in Abuja, Nigerian Tobacco Control Alliance (NTCA) and Corporate Accountability and Public Participation Africa (CAPPA) are pushing for a rise from the proposed 13 million naira in the 2025 budget to at least 300 million naira for the Tobacco Control Fund (TCF).
This year-on-year patronage increase are no doubt steps in the right direction, but a far cry from about 300 million naira needed for operationalization of tobacco control fund. The Nigerian failure to close this funding gap has made legislative and enforcement efforts ineffective, with their consequences on public health. Tobacco is the leading preventable cause of deaths and diseases. It's killed half of its users. In fact, according to the federal government records, no fewer than 26,800 persons die each year from tobacco use. Tobacco-related illnesses lead to catastrophic health expenditures, particularly for the poor, trapping families in a cycle of poverty.
We are calling on the federal government to significantly increase the tobacco control fund beyond the present 13 million naira allocated in the 2025 budget in the interest of public health. We reiterate our call for an upward review of the allocation for tobacco control to a minimum of 300 million in line with the provisions of the National Tobacco Control Act. While we commend the government for increasing the allocation to the TCF, 10 million naira in 2024 to 13 million naira in 2025 is still a very small and insignificant amount, but we appreciate what they're doing, but it is still grossly insufficient compared to the level of funding required for the effective implementation of the National Tobacco Control Act.
As Nigeria marks the 20th anniversary of the WHO Framework Convention on Tobacco Control, the group stressed the robust funding is critical to shielding Nigerians from tobacco's devastating health and economic toll.